Good morning, wherever you are. This is Sophia Reyes from ConferenceHype. Our segment will focus on prior decompensation, identifies patients at high mortality risk despite standard therapy after variceal hemorrhage, and IPD meta-analysis. From the 2026 July 22 edition of Clinical Gastroenterology and Hepatology. Background: in patients with variceal hemorrhage, non-selective beta blockers plus endoscopic variceal ligation are recommended to prevent rebleeding when preemptive TIPS is not indicated or placed. Methods: systematic review and individual participant data meta-analysis of studies, including patients with cirrhosis and VH not eligible for PTIPS in child pug class AB, and receiving NSBB plus EVL to prevent recurrent bleeding. Results: 13 studies contributed 1659 patients, CP class at 805, B 853, 606 had prior decompensation, 121 ascites, 154 encephalopathy, 106 ascites plus VH, 225 VH alone. Discussion: among patients with child pug class AB cirrhosis who were not candidates for preemptive TIPS and were treated with NSBBs plus EVL after VH, prior decompensation identified a subgroup at increased risk of mortality in whom the potential benefit of TIPS warrants further investigation. From the 2026 June edition of Clinical Gastroenterology and Hepatology. Background, and AIMS. The impact of biologic treatment for inflammatory bowel disease during pregnancy and lactation on infant psychomotor development is barely studied. Methods: the study included patients and infants from Dumbo, an ongoing prospective observational registry of GETECCU enrolling pregnant women with IBD from 60 centers across Spain. Results: in total, 352 children born to 343 women were assessed. 134 infants were exposed to biologics during pregnancy and 80 during lactation, including 5 who were exclusively breastfed. Discussion: exposure to biologics for IBD in utero or during breastfeeding has no negative impact on psychomotor development in infants. From the 2026 July 21 edition of Clinical Gastroenterology and Hepatology. Background, and AIMS. Metabolic dysfunction-associated steatotic liver disease is a major cause of liver disease that is growing in prevalence. Methods: a retrospective cross-sectional single-center analysis of abdominal NCCT scans performed between 2012-20 for any indication in adult subjects. Results: 3,646 NCCT scans from 2,710 adult patients were analyzed. Discussion: we found that incidental hepatic steatosis in non-contrast CT is reported in a minority of scans. From the 2026 June edition of Clinical Gastroenterology and Hepatology. Background, and AIMS. The visualization of the whole colonic mucosa with complete colonoscopy, including cecal intubation, has been accepted as a quality parameter for screening colonoscopy. Methods: we did a linkage of individuals that participated in an Austrian colonoscopy quality assurance program to the Austrian death registry to obtain information on deaths of post-colonoscopy colorectal cancer. Results: a total of 349,782 screening participants between January 2012 and December 2022 were included. Discussion: the endoscopist's CIR is strongly associated with their ability to detect adenomas and proximal serrated polyps.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 July 22 edition of Clinical Gastroenterology and Hepatology. Background, and AIMS. Acute severe ulcerative colitis is a life-threatening manifestation of ulcerative colitis. Methods: European, North American, and Asia-Pacific gastroenterologists participated in a 4-round Delphi panel and consensus meeting, forming the refined evaluation framework and investigations for diagnostics in ASUC working group. Results: panelists agreed there is unmet need for ASUC criteria in contemporary practice. Discussion: this consensus provides new diagnostic criteria for ASUC in the modern therapeutic era that can be applied to patients already in receipt of outpatient treatments. From the 2026 July edition of Clinical Gastroenterology and Hepatology, eosinophilic esophagitis is a chronic immune-mediated disease characterized by esophageal dysfunction due to eosinophilic infiltration. One evidence suggests a progression from inflammatory to fibrostenotic disease in many patients, but no consensus exists on how best to monitor the clinical trajectory of EOE. From the 2026 July edition of Clinical Gastroenterology and Hepatology, bowel disorders of gut-brain interaction, such as irritable bowel syndrome, functional constipation, and functional diarrhea, are commonly encountered in gastroenterology and primary care clinics. The severity and perception of bowel symptoms among patients with DGBI can vary across different age groups, and understanding how symptom experience changes with age may inform better management strategies for these conditions. From the 2026 July edition of Clinical Gastroenterology and Hepatology, metabolic dysfunction-associated steatotic liver disease is the most common chronic liver disease among youths 12, affecting an estimated 13% of the general pediatric population and 47% of those with obesity worldwide. 3. The disease often progresses from simple steatosis to metabolic dysfunction-associated steatohepatitis, fibrosis, cirrhosis, and ultimately hepatic failure. MASLD also exerts significant burdens on extrahepatic organs, particularly the cardiovascular system. Several prior studies have reported a positive association between MASLD and subclinical cardiovascular damage in youths 45. However, it remains largely unknown whether the detrimental cardiovascular effects of MASLD in youths are permanent or reversible. Herein, using data from the Hyundai Childhood Cardiovascular Health Cohort Study, we aim to investigate whether a transition from MASLD to non-MASLD over a 2-year follow-up could alleviate associated subclinical cardiovascular damage in youths.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May edition of Clinical Gastroenterology and Hepatology, Background, and AIMS, cardiac dysfunction is a key factor in the pathogenesis of hepatorenal syndrome, for which terlipressin is the recommended first-line treatment. Methods: 22 patients with decompensated cirrhosis and ascites enrolled in a prospective study of home continuous terlipressin infusion were included. Results: the median age was 61 years. The median model for end-stage liver disease score was 15, and 72.7% were male. Discussion: long-term continuous terlipressin infusion resulted in a significant increase in cardiac reserve and attenuation of the hyperdynamic state usually observed in decompensated cirrhosis. From the 2026 July 22 edition of Clinical Gastroenterology and Hepatology, Background, and AIMS, supragastric belching significantly impairs quality of life. Methods: in this randomized controlled trial, 72 patients with supragastric belching, diagnosed according to Rome IV criteria, were randomly assigned to structured singing therapy or diaphragmatic breathing, at 2 tertiary gastroenterology centers in China between October 2024 and April 2025. Results: after 1 week, singing therapy demonstrated a significantly higher response rate than diaphragmatic breathing, both immediately post-intervention and at 1-month follow-up. Discussion: singing therapy is superior to diaphragmatic breathing for supragastric belching, particularly in older patients with severe symptoms. From the 2026 July edition of Clinical Gastroenterology and Hepatology. Hepatic encephalopathy remains the most frequent and relevant complications after the insertion of a transjugular intrahepatic portosystemic shunt in patients with liver cirrhosis. Given that prophylactic treatment is potentially available in the form of lactulose or rifaximin, it would be appealing to identify a group of patients at very high risk for post-TIPS He in whom primary prophylaxis might be justified. Currently, established risk factors, such as a higher model for end-stage liver disease score or sarcopenia, are not very reliable at an individual patient level to establish personalized treatment strategies. 1. Ammonia is the key metabolite involved in the pathophysiology of HE2. However, ammonia levels measured before TIPS insertion alone are not useful in identifying high-risk patients. We hypothesized that ammonia levels measured within the first days after TIPS might identify patients at high risk of He. From the 2026 May edition of Clinical Gastroenterology and Hepatology. Background, and AIMS. Current screening and surveillance in Barrett's esophagus identifies only a minority of esophageal adenocarcinomas. Methods: upper endoscopies with BE in GI Quality Improvement Consortium Registry from January 2015 to July 2022 were categorized by indication: B screening, surveillance, or non-B related. Results: of 88,370 cases with histologically confirmed intestinal metaplasia, 88.1% were nondysplastic. Discussion: BE is found incidentally at rates approaching those seen in dedicated screening exams.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the May 2026 issue of Clinical Gastroenterology and Hepatology. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.